Can you tell I'm a little aggravated by this? But then the second is when you're reading research, what they mean when they say certain terms, and hopefully highlighting that for some people when they just look at the abstract of a study and go, oh, they did physical therapy, or they did chiropractic, or they did this, and you think you know what that means, and I promise you no. So first up, gaze direction recognition task on pain. The control group only received conventional physical therapy interventions. Well, what does that mean? Don't just assume, oh, physical therapy interventions. So they got, just a bunch of exercises. Participants in the control group received selected physical therapy rehabilitation. Each session of the selected physical therapy program began with the application of a hot pack to the neck and shoulder region for 20 minutes. So a third of your appointment time is just having somebody place a hot pack on you, followed by 20 minutes of a TENS unit. So 40 of the 60 minutes is just you sitting there either with a hot pack on your neck or a little stim machine just kind of buzzing along. Okay. After that, they had ultrasound therapy was administered for 5 minutes to the affected neck muscles. Look, ultrasound has terrible, terrible results in the evidence. The control group had 20 minutes hot pack, 20 minutes TENS, and about 5 minutes of ultrasound, and they show you the intensity. And then, in addition to these modalities, which is a majority of the appointment, where these patients received 3 times a week for 8 weeks, was mostly hot packs and TENS units. Can you tell I'm a little aggravated by this? This is quote unquote standard of care. Like, I know it says physical therapy, but this overlaps with chiro. I am livid that a lot of things are considered, like this is considered a standard of care. Again, I think this is while it may answer some questions from a research perspective, this is thoroughly inadequate to be considered great care across the entire population for people who suffer cervicogenic headaches for a multitude of reasons. Like, that is egregiously poor standard of care even for this subpopulation because of how much time is spent on passive modalities that we could almost flip as far as what the patient gets. Like, do you really need to go into a provider for an hour to have them put a hot pack on you in TENS unit, which are over-the-counter things that you can do at home at your own discretion and pay somebody for? No, you don't need to come in and overpay for somebody just to watch you and put a device on your neck.